everybody out there. This is Nancy Silvertooth. I am here on behalf of the Franklin County Democratic Party this morning. The Franklin County Democratic Party sponsors this Common Sense Matters program, and we're here every second and fourth Thursdays at 8 a.m. And we try awfully hard to bring you information that's helpful, that will help you in your everyday lives, things you get up and deal with every day. And today I think you'll really like our guest. His name is Charles Whitmer. And before we go further, I'll tell you a little bit more about Charles, but I want to tell you two dates. May the 19th is Jackson Day in Nashville, and I didn't bring my printout with me. Franklin County has a table of 10. The tickets are $125 each. It's a fundraiser. Senator Amy Klobuchar will be our guest speaker, and that's on May the 19th. On May the 20th, on Saturday, our regular Franklin County Democratic Party meets at 9 a.m. in the large community room at the Annex. And I'll give you my number out a little more later, but it's 962-4982. Later on, after I leave here, if you'll give me a call, I'll give you more details if you're interested in attending one of those. Getting back to Charles Whitmer, I first met Charles Whitmer about, I believe it was in 2014, in groups that were signing people up for the Affordable Care Act in Sewanee. Charles is a Rule 31 mediator and facilitator, and he can explain to you what that involves. He's also the executive director of Cumberland Center for Justice and Peace. That's a small nonprofit organization. It's in Sewanee that serves people in Franklin, Marion, and Grundy County with information and just special things they need to know with regard to basic human needs. And Charles is executive director of that organization. That's my type of organization. It's small. It helps people give direct information, and he will tell you more about that. And by the way, one of the interests of this organization and Charles is health care. Health care is big out there. It's gotten pushed off the national news the last couple of days by other things. But health care affects actually all of us, as Charles and I were talking just a while ago, not only people that need health care, that are sick, but others as well. Charles got his BA degree from University of Washington in Communications and International Studies and Human Rights. He also has international relations. He studied international relations at George Washington University. He's attended Lipscomb University Institute for Conflict Management. Probably has to do with his mediator job, and that's an interesting thing. That has to do with court system and mediating court cases, and of course that's right down my alley as well. Charles has spent some years in other countries and is very familiar with the healthcare situation, of course, in our country and others. And I'm so glad to have Charles here this morning, and I think you'll like learning. You're going to learn something when you listen to Charles. So, Charles Whitmer, go.
Oh, thank you, Nancy. It's quite a treat to be back on the radio station. And thank you very much for the very kind and wonderful introduction. But yeah, I'm very excited to talk about my experiences of the impact of sort of the scarcity of healthcare insurance options in this area that I've noticed, as well as the experience I've had in both England and Germany, and to some degree Canada, with their, but of course obviously the U.S. as well, with their medical insurance systems. And one of the things that's really struck me is I've been someone who's been pretty lucky throughout my life to have what's considered decent medical insurance coverage in the U.S. And it's absolutely terrible compared to at least England and Germany, where I've had some personal experience in actually going through and using the systems they have developed in those countries for providing medical insurance and medical services for people. I mean, it's stunning to me that even, currently my primary insurance comes through my wife's job, and even that's heavily subsidized, and even what we pay as the employee's contribution to that is a little bit more than what we were paying for completely unsubsidized insurance in Germany. In Germany, we were paying about $600 a month for the two of us. Anything you wanted, podiatrist, dentist, new glasses, any doctor you wanted, dental care, all of this was covered, no co-pays, nothing. And we actually had significantly better insurance over there for less than we do here too. So it's definitely an issue. It's really been striking to me that in the last few years, it seems like it's hard for me to imagine that there's nobody out there that hasn't known someone that's benefited from the Affordable Care Act. As far as getting insurance for the first time, that really struck me when Nancy mentioned one of the first times we crossed paths was at these Affordable Care Act signups, and it was incredible to me how many people who were in well into adulthood and were so thankful that finally they had the opportunity to buy something that was reasonably affordable. Obviously, there was quite a few people in the gap. For those of you that are perhaps familiar with the details of, there's a gap between the poverty line and about $30,000 a year. I think Nancy's probably more familiar with the wonky details of the policy, where people couldn't afford it. So it has a lot of cost. There's this idea that everyone has access to this, which really isn't the case in my experience. And the other really frustrating thing is that this idea that, well, everyone needs to pay for their own. For right or for wrong, for better or for worse, there's a pretty significant chunk of the population around here that can't afford it, can't get access to health care. So then what happens? They've got some chronic medical condition, maybe diabetes, for example. They don't have a chance to go to a doctor to get that checked up. They might even not have access to a blood sugar monitor. So eventually they have some sort of a health crisis. They take an ambulance ride. They go to the emergency room. They get stuck with a $4,000 bill. They can't pay that. Goes to court. One of the things that I noticed as doing some work as a mediator is if you look at the civil court dockets, especially for General Sessions Court, and at least both Grundy and Franklin County, about half of the cases you'll find in there are medical debts, people that took an ambulance ride that didn't have insurance, couldn't afford it. And so I would argue that we do essentially have socialized medicine in this country. We just do it in the most inefficient way possible. We're all end up getting stuck with these bills. The hospitals, get stuck with them. Our insurance companies get stuck with them. So that money gets collected from all of us that have insurance. It just comes in a very indirect and non-transparent way.
That's right, Charles. And something that I heard or noticed last night in going through some articles from Tennessee Justice Center. Another small hospital, a rural hospital, is about to close. It is in danger of closing. It's in Polk County. And in that article, and this is reliable information, what Tennessee Justice Center puts out, I believe they're on top of this. This article said that Tennessee is the worst state, has more closings of rural hospitals than any state. And that's sad. And I see people when I'm out and about and talking about insurance, they'll say, oh, yes, I believe everybody ought to have insurance, but I shouldn't have to pay for it. They ought to have to pay for it themselves. And Charles and I were discussing just before we came on, and as he just pointed out, we're going to pay. All of us some way are going to pay. And who wants to, regardless of income, who wants to move to a county that has no hospital to go to? So we've got to start thinking different from what we are. This thing of, oh, they're sick because it's their fault, they should have taken care of themselves, that just doesn't fly with me. And it's costly to all of us. And I'm going to say one thing here and turn it back over to Charles, but I've copied off a Brookings Institute article that I got just this morning, and that's talking about the effects of this new AHCA that senators are considering right now. And one thing that they point out is, due to the one-sided nature of the AHCA's per capita cap, we hear a lot about per capita cap, there would have been no winners among the states, only losers. What they did is went back, I think, to 2000 and did an analysis of how states would have been affected if this AHCA had been in effect instead of the ACA, the Affordable Care Act. And again, they say that due to the nature of this AHCA's per capita cap, there would have been no winners among the states, only losers. And Charles, I'm very, very concerned about if they'll probably come up with, sadly, some sort of block grant situation to the states that will reduce, no question about, will reduce the Medicaid benefits that states will get. And in states like Tennessee, sadly, our Tennessee supermajority legislature, and even the TennCare Bureau that I've dealt with trying to help people, and you may have had this experience too, they've been very difficult, even hostile to sick people, to poor people and sick people. They were the very ones that need it. So I'm very, very concerned that if they come up with something that reduces the money the states get, it's already bad enough in Tennessee. We have this gap in coverage of people that can't get insurance now. And what are your thoughts on that? Have you run into situations where our state, of course, we know our state legislature refused to expand Medicaid, and in dealings with Medicaid issues, it's very difficult for people. It's not friendly, even unfriendly, and I don't see hardly how ordinary people deal with it.
Well, I've been listening to your description of the attitudes of our local legislators towards expanding Medicare. I would use the word hostile. In fact, I don't want to pick on Janice Bowling too much, but several years ago, and I think she still does this, she was doing some town hall meetings around here, listening to people. And she, at that time, and I think it still is, in a pretty powerful position in terms of actually blocking in the committee level any of the proposals that are put forward to expand the access to medical insurance for a lot of people that are in that are working hard but are above the poverty line but still not in a place where they can actually afford it. So, excuse me. I mentioned the dockets. You'd find things like Southeast Tennessee Ambulance Services, et cetera, these emergency services that people had these thousands of dollars in bills that couldn't pay, that would then end up in court. They'd get a judgment. And I got the idea to actually print out copies of these things and go through with a highlighter pen and highlight all of these. So Janice Bowling could see that, this really does have a cost. Every couple of weeks there's tens of thousands of dollars in judgments that are handed out in the local courts against people that live here, her constituents, because they can't pay the medical bill that they racked up because they didn't have access or couldn't afford medical insurance. So after several rounds, maybe a half dozen rounds of presenting these to her, and she said, "Thanks very much." And Senator Bowling, here's another one with a sum total of $78,000 for the last 2 weeks in Grundy County. These are your constituents that are getting stuck with these bills. Did not seem to faze her in the slightest. She kept saying that, well, what did these people do before? So these aren't these people. These are your constituents. These are our neighbors. These are our friends. These are people that need this, and you're actively blocking this. Why is this? And as far as I can tell, she just has this ideological block that this is something that government should not be providing. The government should not be providing anything other than a basic structure of a court system and perhaps some protections at the borders, but a very limited role of government. And I just think that there's certain things in this country that are important enough for all of us that we need to have some large central agency like the government, whether it's state, local, or federal, to help with that. We don't have some system where everyone has house insurance fire. And if your house catches on fire, then you have to show your house insurance card. And only then do they come and put out the fire. And if not, your house burns to the ground. That would be a crazy system. And that's essentially what we have in this country for a lot of people for medical coverage. Some of us have it. The lucky folks that do. You hope you don't need this, but the idea that we would not make sure that everyone is protected on something that is at some point going to be necessary for all of us is baffling to me, especially when our elected officials can actually see, both on paper and documents, and also in their neighbors, even your Facebook feed. And one of the things that was pointed out to me recently is how common fundraising efforts, GoFundMe, etc., are for people with medical insurance or people that have medical costs and medical needs. I mean, not a week goes by where I don't see one of these pop up where so-and-so needs to have surgery, so-and-so surgery may cost them $15,000, and they're asking everyone they know on Facebook to try and, kick in 10, 20, $100 towards this. I mean, we do have socialized medicine in this country. We just do it in a very inefficient way. People that have insurance are lucky enough to have it. And it's especially frustrating to hear state legislators that have a pretty good plan. I think certainly better than what I've got. And I consider myself amongst the fairly lucky people that have good coverage. That they somehow would not feel that their constituents deserve access to this is strange to me and kind of troubling.
Charles, one of the great advantages that I saw when I started trying to help people sign up for the Affordable Care Act, back when it started, I started going to training sessions and learning all I could, was the miracle, basically, of people with pre-existing conditions could get insurance. And prior to that, I had personal experience myself years ago. 3 small children and a husband who had pre-existing conditions. You just can't get insurance for somebody. I went through that, and when it was first announced that the Affordable Care Act had been signed, it passed muster with the Supreme Court, except for the glitch they threw in. I couldn't believe that people would be opposed to signing up for or having or supporting the Affordable Care Act. I thought, this is great. And, of course, when it first came out, there was this just terrible, and it continued, hatred of, dislike for, I hate to use the word hatred, dislike for President Obama and Obamacare. And I thought at the time, gosh, if I could get insurance, if I could have gotten health insurance for my family back when I needed it, children were small, had a sick husband, I wouldn't have cared if they had called it Bush Care or Nixon Care. Insurance, taking care of my family. And I could not understand, and I still really don't understand why people could have such dislike for. And of course, one reason we know that, and when Tennessee dealt with, when it got to that committee in the Tennessee legislature in January of 2015, Insure Tennessee, I just knew for sure. I had me a list of people that I had talked to who were in that gap, couldn't get insurance, and I couldn't wait for Governor Haslam's Insure Tennessee to be passed. I thought it would. Made perfect sense to me. Lo and behold, they just killed it off, and basically didn't look back. It is as if this ideology was just like a blinder, that no matter what you said, no matter what sort of information or examples of people that were in terrible situations health-wise, it didn't matter to those folks, and those folks in the legislature then, and it's continued. You used the word baffled, and that's the way it baffles me to this day, how an ideology could go before just plain old human compassion.
And what's especially strange is they have great names. You were talking about the Affordable Care Act and Obamacare, which is essentially the same thing, but I think language makes a big difference in how people perceive things. You've probably heard those polls where if you ask people if they support the Affordable Care Act, most people say yes. You ask them if they support Obamacare, most people say no.
Right.
And with names like TennCare and Insure Tennessee, those seem pretty straightforward. And, I'm a relatively recent arrival here to Tennessee. I guess I've been here about 7 years now. And one of the things that surprised me is that I had thought that, this is one of the first states to really make an attempt in TennCare to insure everybody that needs access to medical insurance. I mean, it was an imperfect plan, and apparently it seems like it hasn't worked out quite as well as a lot of people hoped. But, I think it's important to recognize Tennessee was one of the first states to do that. That's impressive. So I come here, I'm familiar with this, and it was confusing to then see this strong resistance to to any proposal to help out people that really need the help. That's kind of um, a baseline floor to have a healthy population, that everyone's got access to healthcare. You've got healthier workers, you've got a healthier pool of people to fill jobs that need to be filled. And I think for larger companies, I remember several years ago, I might have been longer than that, I'm getting old, but reading an article in the Wall Street Journal that was an editorial by the head of the Ford Motor Company. And he was making the argument that, on an international economic level, we as a car manufacturer are having a hard time competing with the other countries that make cars, because we have to pay for insurance too. In a country like Japan or a country like Germany, the costs of making sure that everyone's got medical insurance are worked into the calculus of the entire economy. And so it's not individual companies that, Toyota doesn't have to worry about negotiating for, with their workers to find some medical coverage. That's just built in, and they could worry about building cars and other things. So it's actually, I think, putting our country at a competitive disadvantage when companies have to worry about providing medical insurance or not for their companies, the costs of that, having workers that have it or don't, making sure they meet certain levels of care. I think a lot of major corporations in this country would probably prefer not to have to worry about that. In fact, I think about having some experience with what was available on the Affordable Care marketplace. I looked at what we had provided by my wife's employer, and my first thought was like, boy, I wish they'd give us just half the subsidy in cash. I could go out and find, for our situation, a much better plan on the open marketplace than I could for the one of two plans that's offered by your employer. One of them's a decent one. One of them is a pretty high deductible, disastrous plan that I think a lot of people, if they could afford something better, wouldn't choose. But we probably have $1,000 a month in subsidies that are given to us through her employer, and with that money, we could go out and find a much better plan that worked for us. So,
well, and with regard to the Affordable Care Act, I have been signing people up actually ever since it went into effect January of 2014. Of course, there was a famous computer glitch. There was a time when it was really difficult, but people are getting insurance through the Affordable Care Act, and of course we hear unsubstantiated. I'll meet people on the street sometimes. They'll say, "My insurance just went up, so and so and so and so and so and so," but there's just this built-in some sort of resentment toward the famous, quote, Obamacare. But I have signed up many people that the Affordable Care Act is good for. A woman told me the other day with regard to her son, said the insurance saved his life. People need health care desperately. I wish that our Congress would simply go in and fix the things that need to be fixed with regard to the Affordable Care Act. And I can think of things. I run into some situations that I wish it would do different. But the pre-existing conditions part of it, that is just invaluable. Just about, and of course we hear the statistics, doctors have even given reports. So many of us have pre-existing conditions of some kind, and of course what they're talking about sounds good to them. Oh well, the people that have pre-existing conditions, put them in a pool, they can get insurance, but they'll have to pay for it. There are so many people that cannot, and I'd like to give as an example the Affordable Care Act policy, the best one I've seen that came out just this last year, that was effective the first of this year. Last year, we kept hearing that premiums were going to go up. Our state of Tennessee, our Commissioner of Insurance had agreed for the insurance companies to charge so much more, and I thought, oh my goodness, people are not going to be able to afford it. I was pleasantly surprised, and in my heart, I thanked Blue Cross Blue Shield. Of course, they had it. I'm sure they were still able to make money. Blue Cross Blue Shield came out with 0 premium policies for low-income people. $20 deductible. I think the out-of-pocket maximum might have been is either $450 or $650. And I thought to myself, well, Blue Cross Blue Shield is doing sort of what Medicaid would have done and what Governor Haslam was proposing. What Governor Haslam's plan was for certain income levels, he had them making a contribution, whereas with regard to with regard to Medicaid, that's what I'm trying to say. Medicaid does basically cost. There's no premium. You don't pay. But if they would have just passed Governor Haslam's Insure Tennessee, many people out there could have gotten insurance, and hospitals would have been better off. People could have been treated. But they not only did that, but made it harder for people to get care. And I'm going to say this one thing, then I'm going to turn it back over to Charles. We have a question here. Lost my train of thought. I know what I was going to say. We have elections coming up in 2018. We can see what they've done. We don't have to listen to them. What our Tennessee legislature supermajority has done, their attitudes, our United States Congress, what they're doing, we need to elect people, Democrat or Republican. There are Republicans with good hearts out there. We need to elect our legislators who will do the right thing. Let's get our minds on that. That it looks like is the only way we're going to be able to change this situation. Charles, I see we have a question here. Can you?
Yes, we have a question from a caller that called in. The question is, how do you propose to pay for this great insurance that the government's going to provide? I think it's going to be paid for the same way that my insurance is paid for now. Everyone pays a little bit towards an insurance company. The insurance company looks at the pool of risks and provides coverage at a certain percentage for a variety of insurances. It's not this new system that's going to be built from the ground up. It's just simply finding out a way that everybody can find access to this. The same way I pay it now. I pay several $100s a month. I get insurance from a private company. That insurance provides coverage for various services that I might need from doctors who are all still operating privately. It's not, I think that's, people have this idea that it's going to be a system for 300 people built from the ground up, and it's not. It's a matter in Tennessee of, expanding it to cover maybe 250,000 additional people. So it would basically be, as pretty much every other industrialized country on the planet does, you figure out what it costs to have health coverage for everybody in your country, and then you find some way to divide the payments for it. I think probably one change that would happen if we were to change over to a single-payer system in this country is that people that made more money would end up paying a little bit more for their health insurance. But I think that that's a worthwhile trade-off. So the people that currently don't have access to it can't. Again, it's very similar to the way we operate a lot of things. Everything from, police, fire, schools, these things we take for granted. We all pay a little bit into this, and then we find a way to make sure that everyone gets the services that they need when they need them. I guess that's my short answer to that question.
Well, and what I think about there, of course, with regard to people that have plenty of money, there are people out there, and with regard to the health plan that Congress, that the House just passed, in fact, the wealthy are going to be even wealthier because it has been said, actually, that this bill that's pending, that's now before the Senate, was actually a tax cut for the wealthy. It wasn't even a health care bill at all. And that's what, when you hear the details, you'll realize that. But, so, what's wrong with people that can afford it paying, as you said, a little bit more? If we just all pitch in, I don't really resent all that much the income tax I have to pay now, because there were years there, lean years way back, when I would get, I couldn't wait for tax time to come because I'd get a refund. I'd get my money back. And thankfully, when my income got enough where I could have to pay tax. I don't resent a bit paying more so that somebody out there can have insurance. And I don't really understand the attitude of well, they'll have to pay for it. I remember, I believe it's over in Matthew, Jesus talks about taking care of the least of these, and that is just a drumbeat there to me that started out years ago when I was in Sunday school at Marble Plains, then Methodist Church, and that when all else fails, rely on what would Jesus do. And I actually out there talking to people, helping people. I guess it makes a difference if you actually know their situations, the situations that they're in. But my goodness, to me, just cold enough to say, well, it's their fault. They should have taken care of themselves. I don't know of a situation when you think of Jesus' time on this earth where he refused to give somebody, to help someone restore their health or do anything, and say, well, it's your own fault, you got yourself into this, blah, blah, blah. I just don't get it.
I think another assumption is people feel that we're not currently paying for everyone's health care. And we are. The example of someone that has a treatable condition that can be managed but doesn't have access to doctors or to medical insurance, that medical condition gets to a crisis point at some point. At that point, they end up in the emergency room. Let's say they end up with a bill of $10,000 for several days stay in the hospital and an ambulance ride. They can't pay that bill. So what ends up happening is the hospital ends up essentially having to cover their costs. So at the end of the year, the hospital does their math, and they realize that over the course of the year, on average, we have this much in the way of people that come that we have to provide services for. It's an emergency. They're going to die if we don't. We're both legally and morally obligated to help these folks out at that crisis point. They look at all those bills that they weren't able to collect on. That ends up getting factored into the amount of money that they charge for their services the coming year and the years going forth. And then that ties into how much they're going to pay insurance companies. Insurance companies realize how much more they have to pay for the hospital services, part of which are the bills of people that didn't have insurance. So this money does not just magically appear. It's just what's currently being spent is being spent in a more efficient way. And we're actually able to track this. The hospitals, we can look at the total amount. And I think as anyone knows, it's, with car maintenance or body maintenance, if you maintain this, your costs are going to be a lot lower. If you don't change the oil in your car ever, eventually your engine's going to blow up. And that's a very expensive repair. If you don't take care of your body, eventually something's going to shut down. And that's a very expensive thing to repair at that point. So I think that making sure that everyone has, regular doctor checkups, has access to the basic medicines they need. In the long run, this is a much cheaper way of making sure that everyone's healthy. It's not a coincidence that we in this country spend so much more per person for worse outcomes. We spend, Nancy, you might know the facts on this. I know the amount of money spent on medical care per person in the U.S. is extremely high compared to most other countries. And yet, for some reason, we still have, at least according to the statistics, a relatively unhealthy population. And I think that that's also a factor in this. I think that one of the sort of dirty little secrets, if you want to call it that, about the way that we provide medical services in this country is that there's really nowhere, with the exception of the health insurance companies and the individuals, there's not really a financial incentive to increase people's health. There's no money to be made having a healthy population. There's a lot of money to be made having a sick population. And I think that might be something we've tipped into in this country, where we don't have an interest in making sure that everyone's healthy so we can all be healthier, which is, I think, a public good, and that would save a lot of money. I'm just baffled by the fact that what I ended up paying in a free market system in Germany for medical insurance is less than what I pay here. And what I pay for here is heavily subsidized by an employer. Like something's not working here. So we are all paying for this. We're just doing it in a way that's very diffuse, not very well tracked. It's, these bills are showing up everywhere from court dockets to Grundy County to ambulance companies that go out of business to hospitals that can't stay in business. And if we figure out some way to make sure that everyone's got access to this, it'll be a lot cheaper and we'll be a lot healthier as a country.
And Charles, I think health or bad health, addiction, and mental health issues, those are not respecters of persons. They affect everybody. I worked in the court system as circuit court clerk for 24 years. Then I went over and worked for Miss Christine Hopkins in her jail reentry program for 2 years, right in the jail, working with inmates. I was just amazed that, shocked that it's shocked that the addiction problems that exist, and many of our people that are in and out of jails have addiction problems. Those problems are not respecter of persons. Anybody can have a family member with an addiction problem or a mental health issue. They need treatment. And with regard to our paying for it, people in the Franklin County Jail come out of there now that don't have insurance, that don't have the money to get treatment. Most of them need treatment of some kind, including mental health, including for addiction issues. Well, guess what? They don't have insurance and they can't get it. But is it costing us? Yes. We're about to add on to our Franklin County Jail. The taxpayers of Franklin County are going to pay. And terrible things happen with regard to people that have addiction issues. They die. It devastates families. With regard to mental health issues, terrible things happen sometimes, and every time I hear about some tragic event that happens involving a person with a mental health issue, I can't help but think, I wonder if treatment was available for that person. I wonder if that person had some type of insurance. And it is just heartrending to me to think of the suffering, the devastation that people, and this is not just poor people. These problems can affect anybody, and even ordinary middle class families have a problem dealing with medical treatment of thousands, maybe hundreds of thousands of dollars. Mm-hmm. So we need to do something different. We need to, it looks like bottom line is, change our people in the legislatures and handle this situation the way it ought to be.
That's an interesting, what you just brought up about the costs of addiction and mental health that ends up being steered towards the criminal justice system of this country, I think is another example of the costs that we all pay for this. Somebody has some addiction issues that perhaps relate to mental health issues. There's not much in the way of treatment for that. So there's nothing in the way of readily available access to treatment. This addiction continues, and so what is the treatment that's offered? Eventually they get caught stealing something to feed this addiction. They're stealing my TV, they're stealing your TV, whatever it may be. And so, these costs that could be figured out in a way to easily provide these for everybody. Sure, there's costs, but I think that it's a lot cheaper to provide someone with addiction services than it is to keep them in jail. It's probably a lot cheaper to provide someone with mental health services than have the police respond to their house when they're having a breakdown or something. And it's a lot cheaper to provide addiction services than to have random numbers of people having things occasionally stolen from them for this person to feed their addiction. So again, I think that's something that a lot of people, when they say, well, how are we going to pay for this? We're paying for this already. We are paying for this, and we're paying a lot more than we need to for this. And how we're paying for this and who actually pays, whether it's a hospital that has so many uninsured patients that they end up going out of business, or whether it's someone that has their car stolen, we're just doing this in a very inefficient way. I'm not sure if I have all the answers, but one thing I'm pretty confident about is that we are not doing this in a good way in this country. We have an unhealthy population. We have incredibly high medical costs. There's hundreds of thousands of people in Tennessee and millions across the country, citizens, fellow countrymen that don't have access to medical coverage, and that's a problem. I mean, that should be an embarrassment for a country that's doing as well and is as great as the U.S. is. We're one of the wealthiest countries on the planet, and we're the only country that can't figure out a way to make sure that everyone has basic medical coverage. That's crazy.
It is crazy, and I want to. I'm about to. I may be beating a dead horse, but I want to stress, and I can say this from personal experience, helping people get signed up for insurance and Medicaid, TennCare. Of course, our Tennessee legislature continues to refuse to expand Medicaid. We don't know what's coming down the pike for sure from our federal government. But anyway, Tennessee has turned a cold shoulder to doing anything better for health care. In 2014, I think I said this, in January 1st, 2014, when the Affordable Care Act became effective, the state of Tennessee is the only state that, by December 31st, got rid of many Department of Human Services employees that were actually helping people in their local offices sign up for TennCare. They got rid of them, and basically, I think the thought was, okay, just go. They resented Obamacare and Obama so much that it was a spiteful thing. Oh, just go online. And so what did that do to many, many, many sick, poor people, the most vulnerable among us out there? It threw them in such a turmoil that finally, later on that year, Tennessee Justice Center and I think a couple of other organizations actually filed suit in federal court because the state was supposed to come up with a computer system that would handle it. They got rid of their employees. Well, that flopped. And they still haven't. To this day, they haven't. People were filing filing for TennCare and just not receiving any decision at all. Well, Tennessee Justice Center and another organization, I believe, filed suit in federal court and said, hey, Tennessee, you're not complying with federal law that says you have to make a decision on these claims within 45 days. And so the federal judge told the state of Tennessee, hey, you got to comply with federal law because why? They're getting a lot of this Medicaid money from the federal government. And so they started having to do a little better, but it took court action. And to this day, I just got through helping a gentleman with a child. He had filed his these redetermination packets you're getting out there. Be sure and get those back by the date it tells you to. He had filed his redetermination packet in January. Couldn't hear anything. Nothing. I started working with him on April the 3rd, calling TennCare. Finally wound up calling Tennessee Justice Center and getting them involved. Finally, on May the 4th, we found out that they acted on his TennCare, and he'd been without insurance all that time. It's a shame the way the state of Tennessee, the legislature, and the TennCare Bureau has done and is still doing people. So I tell you, there needs to be a change, and it needs to. Next time next time you get a chance to vote, find out how they feel about insurance, Democrat or Republican or independent. Find out how they feel about insurance for people and taking care of, quote, the least of these, which we're supposed to do regardless.
Mm-hmm. Yeah, it's tricky. It's I think another thing is that there's a lot of options here. It doesn't have to be the government controls everything when it comes to medical insurance and health care provision, or it doesn't have to be the government provides nothing. There was a proposal that I read, I think this might have been back maybe 10 or 12 years ago, where the idea was to have the federal government provide insurance for medical coverage for everything above a certain dollar amount, and that everyone would be responsible for finding a private plan that covered up to that amount. I don't know if the the limit was $50,000 or $100,000 a year. So the idea would be, at that point, you're looking for insurance that covers a maximum dollar amount of probably what our car insurance covers. $100,000 a year. If a private company, insurance company, knew that the maximum they'd have to pay out for this person would be $100,000 a year, then there's a reinsurance system that's sponsored by the government for everything above $100,000 a year. Relatively few people rack up medical bills of over $100,000 a year, and I think that a lot of us could find a variety of options that would cover the first $100,000 relatively easily. And I think that would be a lot cheaper. I think one of the big question marks that drives medical insurance costs so high is that the sky's the limit. The insurance company doesn't know what the potential limit for what they might have to pay out that year. It could be $2 billion. It could be nothing. So they not knowing that makes it tough for them to really make an accurate calculation. But I think it'd be pretty simple for them to figure out how many people actually rack up bills of over $100,000, and they could do the math based on that. So I think that one of my big frustrations is seeing this adamant opposition. Senator Janice Bowling blocked, I think, 2-3 different plans that came through in the last few years. And what do you suggest, Senator Bowling? What we have now is not working for hundreds of thousands of people in this country. You can't in this state, you can't just consistently block things and not offer a counterproposal. So I hope that the status quo is costing us a lot. It's not working for a lot of people, a lot of constituents. So I would hope that our elected officials would come up with something. Don't just say no. Offer something in return.
And the reality is, our sick people, our low income folks, they're not going away. Are we just going to because of this? I've begun to think of it as the ideology or the ideologues of blinders. It's just like that blinder is in front of their eyes. That's all they can see, and it doesn't matter how sick someone is. The devastation to families of medical bills, of addiction, of mental health issues. It doesn't seem to matter. They can't get around their ideology, and that is just absolutely crazy to me. Again, find out how people feel about taking care of other people. If they have this ideologue or this ideology that those have that absolutely refuse for some reason to help everybody have insurance. If they think, don't elect them again. Elect people who have a heart.
Yeah, it's right there in the Constitution. I think the phrase is, the federal government shall provide for the common welfare. What is more important to the common welfare than making sure that all of us have some decent health, that we can go about our jobs? Another thing that I think is kind of an odd thing about this country is how we have, for so many people, their medical insurance coverage is tied to an employer. I mean, I know plenty of people that have stuck with jobs that they would prefer not to. They want to go out and start their own business. They've got a family. They can't take the risk of giving up their employer-provided medical coverage. I think that in this country, we'd have a lot more opportunities for entrepreneurship, for people to take a risk and start a business, if they knew that they had some safety net there. They knew that they would still be able to access medical insurance for themselves, for their families. They would take that risk, and I think that that's another one of those sort of hidden economic costs that we are bearing because we're not looking at options to change the system we have right now, which works for me, doesn't work for a lot of people.
Well, and that is big also, Charles, is as you say, many people are stuck in jobs with employers that they feel like they have to stay with for insurance purposes, whereas with the Affordable Care Act, you can go out here. In Tennessee, of course, you have to have a certain level of income because they refuse to expand Medicaid, but you can get your own insurance, and it's usually, regardless of what the hard tales people talk about, for low and middle income people, it's great. And of course, the more you make, the higher your income, the more you're going to have to pay, and maybe the higher deductible. But that's just the way it is.
Well, and for you, I think about small business owners. They're the core of the economy of this country. If they didn't have to worry about the cost in providing medical insurance for their employees, think about how much more they could do with that money. That would be something they wouldn't have to worry about. Just like they don't have to worry about providing insurance to make sure that all their employees' houses don't burn down. That's something the government does and does well. It's something we're all going to need. And I think that finding some way to detach our medical insurance and our ability to stay healthy and get the medical services we need from our job is important. I mean, I think medical costs are one of the leading causes of bankruptcy. Most of this country is one or two paychecks away from being in a really bad spot. Both losing your job, a healthcare crisis, and we can do better in this country. I just hope that in the last couple of years, more and more people have known somebody, have had some experience with actually getting a benefit that they weren't able to access through the Affordable Care Act. It's baffling to me that at this point, after so many people have known people that have benefited from this change, that we're looking at rolling this back on a national level. So,
pay attention to what they're doing in Washington right now, and it's very important. It could be life-saving for you.
All right, and y'all will be back on the 25th, am I correct?
I believe that's right, Karen.
All right. We are WCDT Winchester. It is 9 o'clock.
it was fun.